breathe your name. Somebody declare, just breathe your name. Just breathe your name. Your name. Just breathe your name. Lift your hands like a father and declare, just breathe your name. Just breathe your name upon me. Breathe. That is such a powerful song. Breathe into us that breath of life. We became that living soul. That is done sin. Oh, again. Just breathe your name upon me. Say good morning to Singing Marjorie. Singing Marjorie, love and blessing goes out to you from Mr. Santa Cruz. And all of us here at Sky 99.5 FM. Today is your birthday, and we're just sending some love your way. Thank you for your love. Thank you for your support. For your calls. And may God continue to bless you real good. With wealth, wisdom, and health. Talking about health. In just a few moments, we have Dr. Batson of Batson and Associates. He's here with us, live, ready to go. So, thank you so much for joining us. And we're going to see Mr. Blake. I'm going to see what I can do for you, all right? Just a little bit later. I'm going to see if I can play that song for you and the wifey, celebrating your anniversary and her birthday today. I'm going to see what I can do for you. All you birthday people, happy birthday. Have an amazing day. Hey, up next, Dr. Batson of Batson and Associates, right here on Sky 99.5 FM. We're best when balanced. Be sure to check out Batson and Associates for female hormonal dietary supplements that aid a regular menstrual cycle, menstrual pain, hormonal imbalance, ovarian cysts, polycystic ovaries, and more. For further information, please call 222-8261, 341-4813, or 336-0120. You're only with a melody. You surround me with song. Deliverance. My tears is cold. No longer slave. No longer fear, no longer slave to bad health. Right here with Dr. Batson of Batson and Associates, right here on Sky 99.5 FM on a Sunday morning. Good morning, Dr. Batson.
Good morning, Brother Dion. How are you doing, sir?
I'm all right, sir. You're so nice and strong, ready for them today.
yeah, definitely. And yeah.
What's your week this week?
Week was good, Week was good.
Nice, man.
Yeah, productive as usual. Let me say a pleasant good morning to the listeners of Sky 99.5. Always a pleasure to be in your company. Let me say a pleasant good morning to our Facebook family. They're coming in hot and hurry.
Is that there's a name that you normally call first? Like she's always there ready to go.
Oh, Miss Pamela Moses.
Yes.
Pleasant good morning to Moses, Miss Melissa Edwards, Pauline McKenna, Miss Henry Rajpal, Miss Sherman Pierre. Like was I raised this morning, but let me see who reached first. Miss Harrington was the first person. After Harrington was Grace Warner Headley, Rachel Johnson, Elizabeth Nandlal, Nikisha Holder Marshall, Honeybee, Miss Kathleen Ishmael. Pleasant good morning to all you guys. So this morning we're going to have a very interesting discussion. I'm going to touch a bit on eyes because this eye situation for some reason is not going away. More and more persons having problems with their eyes, more and more persons going blind, unnecessarily so. So we're going to speak a bit on glaucoma. We're going to speak a bit on cataracts, and we're going to speak on, what are some of the foods that could actually contribute to making cataracts and glaucoma worse, because there are actually certain things that you could eat to actually worsen that situation. And of course, what are some of the foods that you could eat to actually make that situation better? And of course, what do we at Batson and Associates offer, in that situation? Because more and more you're finding cataracts. And as I was telling someone recently, we are accustomed having the eye optics formula, which would have done so well for so long for so many persons as relates to cataracts. But then we started to get persons with, I think those cataracts were really mature cataracts. And as a result of that, the eye optics wasn't really doing much. So then after, subsequent to that, rather, I went and I got a product called Sincera, which is an eye drop that is specifically designed for cataracts. What I'm working on now is to actually get a supplement that actually helps with removing cataracts, because there are things that you can take internally to actually slow down or remove the body's ability in forming cataracts, because there are certain things that really contribute to cataracts. A lot of persons, if you use a lot of protein, especially animal protein, so if you're a meat lover, a meat mouth, you tend to be more prone to having cataracts as opposed to someone who maybe, may not be, someone who eats a lot of meat, or they more use fish as opposed to things like chicken, beef, those type of things. Good. And we're also going to speak about women who have issues with PMS, postmenopausal syndrome. Again, that's a big issue affecting a lot of persons. We're going to touch a bit on insomnia, and we're going to touch a bit on nerve restore, because that product is a product that we actually were marketing heavily for this entire month of April. We have it on special until the end of April, and that was really to familiarize persons, get persons accustomed to using the product and making them aware of it, so that it would help in cases like sleeping, anxiety, depression, that type of thing. A very good product for women who deal with PMS situations. Okay, so glaucoma. Glaucoma is basically high ocular pressure in the eyes. There are basically two types of glaucoma. You have open angle glaucoma and you have closed angle glaucoma. And basically, where the pressure is, or the ocular pressure in the eye, would determine what type of glaucoma you have, whether it's an open angle case or a closed angle case, right? The thing with glaucoma indicates a number of things. One, it is a clear indication of some level of dehydration, because in most cases, you find persons who have glaucoma were persons who, they don't really like water. They're not really water drinkers. So if you are a glaucoma patient, that's something that you should revisit in terms of, looking at how much water you drink, because, hydration is everything. That's something I consistently try to, help persons to understand. Hydration is everything. If you're not properly hydrated, you cannot be healthy. So that's one thing you need to look at. The thing is, if you have glaucoma, one of the things that you need to also pay attention to is circulation in the cerebral hemisphere. So when we're talking about the cerebral hemisphere, we're primarily speaking about what? Your brain, right? So the thing is, if the circulation and the oxygenation is better in the brain, or it's optimal, you find it is very difficult for you to have glaucoma. And that's something that you need to pay close attention to. So a lot of the times, if you're someone who have a lot of problems with sinusitis, if you have a lot of problems with issues with asthma or nasal allergies, those type of things, it's very easy for you to end up with glaucoma, because the passages, again, in the brain itself, they're not clear. So, it doesn't allow for proper exchange of waste. It doesn't allow for proper circulation, because we know the importance of circulation, right? Circulation, blood circulation, is responsible for transporting oxygen and nutrients to cells in the body. Your lymphatic system is the system that cleans your circulatory system. And the lymphatic system is a system that, once it's functioning optimally, you're going to have proper blood circulation. So in some cases, there's some things that persons may need to look at. Your lymphatic system may not be functioning as optimally as it should, and as a result of that, you now have a problem with circulation issues. So that's something to pay very close attention to. How do you improve your lymphatic system? Water. because your lymphatic system only utilizes water for cleaning. It cannot utilize coffee, soft drink, juice. It cannot. Anything else. It needs to get water. We know the rule for drinking water. The rule for drinking water is your body weight divided by 2 in ounces. So that's something that you need to pay very, very close attention to, and something you need to try your best and maintain as much throughout the day as possible. I know for some persons, it might be a little difficult depending on the jobs that you may have. Some of you work on the road, and as a result of that, you tend to be very, it's very difficult to find a washroom, especially if you're a female, and that's something that we're mindful of. But try and play catch up on the days when you're home. So like if you're not working on the weekend, Saturday, Sunday, try and drink more water, because those days that you're home, you have to find a solution. You can't just simply say, well, I work on the road and I can't drink water, and leave yourself like that. You're going to end up in problems, obviously, right? So you need to find a solution to that particular situation. So that's one thing you need to look at. Foods that would make glaucoma worse: coffee. So all you lovely coffee drinkers out there, I know you might want to hear that, but if you have glaucoma, coffee is not something you should be interfering with, nor should you be interfering with milk, dairy, milk. You need to watch your meat intake, especially red meat. That's something that you shouldn't be partaking too much of. Because I'll tell you something with glaucoma. Glaucoma is literally the stealer of eyesight. It will blind you faster than cataract. It will blind you faster than macular degeneration. Retinal detachment, possibly, because that's bleeding behind the eyes, which usually is something that is reserved for diabetics, really bad diabetics. However, you have non-diabetic retinopathy, which is bleeding behind the eyes that persons would get, and they did not diabetics. But of course, as a diabetic, it becomes very easy for you to end up with retinal detachment because of what is involved in having diabetes, where you would basically have high levels of inflammatory response in the body, severe poor circulation. And we know once your microcirculation is compromised, which is very easy to happen to a diabetic as a result of the high levels of glucose in your bloodstream, it becomes more and more difficult for you to actually maintain proper eyesight. So that's something that you need to be very, 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 very cautious about. It's something that you need to be on your P's and Q's with that. Hypertension is something you also need to pay very close attention to, because it's very easy for someone with hypertension to end up with glaucoma, even though some medical professionals would disagree. But I mean, in my experience, my excess 14 years experience that I have, and the amount of persons that I've dealt with, especially in the instance dealing with eye problems, you find they are closely related. So you need to be very careful. And then sometimes even the medication that you use, because the thing with glaucoma, most of the eye drops is steroid eye drops. And some people I know, you have to use 3, 4, 5 eye drops, and the situation doesn't get better, it just gets worse. And the reason for that is because you're not really dealing with the root cause of the problem, which is to really clear the passages to ensure that, remember, the cells in your body must be able to breathe. And if they're not breathing, you're going to have problems. It's just like your scalp, which is why you find that if your scalp doesn't breathe properly, it's very easy for you to end up with what? You can end up with dry scalp, you can end up with dandruff, you can end up with psoriasis. It's the same with your skin. If your skin doesn't breathe properly, you could end up with things like psoriasis, atopic dermatitis, lichen planus, all those things. Remember, your skin is the largest organ of the body. It's called your integumentary system. But your skin plays a significant role in absorption. So everything that you put on your skin is going to go into your body. So, again comes the things like the various creams, and you need to be very careful with those things. Colognes, perfumes. I tell persons those things have to be put on your clothes and not on your skin. You try your best. Women, you like to see you all looking beautiful and stuff, but at the same time, I mean, if you want to have red hair at some point in time, I mean, I can't be vexed with you. I'm not your husband. I can't tell you not to have red hair. But at the same time, if you're putting those dyes in your hair, you're going to be in some problems. So you need to be very careful. Some sort of detox has to be done. You have to drink a little baking soda, get a bottle of Santulan, get some of the alkagen water, juice some celery and carrot, do something, because you can't be coloring up your hair and expect not to eventually get sick. That could seriously affect your eyes, right? So that's something you need to pay very close attention to. Okay, so let me give you those clinic telephone numbers and our locations. We are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chagonas. We also on the corner of Ramsey Trace and the SS Earring Main Road in Debe. We're also in Red Edge Mall, Western Main Road, St. James, and the Triangle building in Scarborough, Tobago. Those telephone numbers, you can give us a call on 222-8261. That's 222-8261. as well as 223-7515. That's for the day office. That number again is 223-7515. That's for Debe and Shogunas, which is basically head office. That number is 222-8261, as well as 314-9975. That's 314-9975. Let me say a pleasant good morning to Miss Jennifer Valentine. She's out there in Texas. A pleasant good morning to Maria Cooper. Tyrone Wise, good morning to you. Miss Annette Robinson, a pleasant good morning to you. She's in New York. Miss Carol. Carol, you have a fancy surname, lady. She's saying good morning. Carol, we'll leave it as Carol for now. Still waiting. Okay, she has to get some information regarding our international clients. Miss Maureen Pierre-Reed, a pleasant good morning to you. Annie Grant. Miss Denise Allison Jaikaran Lane. Papa, good morning. A pleasant good morning to Miss Allison Bridgelal. And of course, our followers on Instagram, a pleasant good morning to you guys. We are live on Facebook. Facebook is Batson and Associates Limited. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. So of course, now we're going to go to the telephone lines because, you know, I try not to talk, and I try to give you the opportunity. You may have an issue that I may not be discussing. So we're going to go to the lines. I'm going to go over to Dion and we're going to try to answer as much questions as we can today. We have 2 hours today, God's willing. So we're going to take as much advantage of our 2 hours and try and help as much people as we can.
Dr. Batson, I have the first question. I'd like to ask the first question.
Yes, sir.
So ladies who use a lot of eyeliner and eyelashes, you know, on their eyes, can that affect them in any way? They always look, some women look like they're under a lot of stress having those things on their eyes. So I'm just wondering.
I mean, the thing with makeup is, I don't understand makeup, honest to God. And people might fall out with me when I say that. Because I really don't understand it, honestly. Because the regime that women have to go through to properly clean the skin after they put all this cake on the face is, you know, is really perplexing to me. But at the same time, there are some women who think they could do without makeup. And I mean, generally, I have seen women, I find some of them personally, you know, if you put on a little something, because I mean, as a male, we don't really have those kind of issues. And I tell them, you know, I mean, why it is you want to paint up your face so? But I mean, you can't tell people what to do because the thing is makeup, and I was actually doing some research recently, yeah? And the research I was looking at was, which queen was it, boy? Was it? But it was in the Victorian era. And one of the things, there was a particular queen that ended up dying because of the amount of makeup that she would put on her face. I can't remember which one it was. Yeah, because she was ridiculous. And then at that time, what they used to put in makeup, I think it was lead and something. So she ended up poisoning herself because of that. But interestingly, I was doing some reading again and some research, and they were saying that, I believe again, in some part of Europe, that there were men who would have filed for divorce, or you would have had the right to file for divorce or separation if it is, because what they call it entrapment, because these women would look one way. And of course, when they take off all of this off your face, you realize who you thought you was going to get married to, or you thought you would have been with. She looks completely different. So that was actually as a form of entrapment. And I'm not trying to be facetious here or anything like that, because even on Instagram and these social media profiles, when you see before and after, I was like, but this thing is, according to people, this OBR, this voodoo, because you're not looking, you look at 20 million times different from how you're really, you're really supposed to look. So, I mean, I think that is a bit, you know, you need to be careful, because if people know what they put in makeup, especially lipstick, they wouldn't put on those things. But, you know, that's a very controversial topic. Women tend to get very offended when you tell them about that, especially if they have to put on the eyelashes and all this fancy. I personally can't deal with all of that. I'm telling you, I prefer a woman as natural as possible. I mean, as I say, if you put on a little eyeliner and put on maybe some lipstick or something, I wouldn't kill you for that. But some of them just overdo it, man. And that cannot be healthy for you, because your pores are not allowed to breathe. And that will get you sick. And they prove that those things damage your eyes. Because remember, once you put on that is getting their pores all in your eyelashes, all there are openings there. So when you keep putting these things, they're going to block it up after a while. Yeah, and then your hair too, you need to be very careful. So and the thing is, your hair needs to breathe. Your scalp needs to breathe. A lot of people don't understand that. I mean, it's only now that I have harassed now, I understand how important that is. So I would have to, even though my head is ramped very quickly, I'm annoyed sometimes at it, but I try not to go and have it done too often where they will have to, you know, palm roll it, whatever the case may be, because I want my hair and my scalp to be able to breathe and that type of thing. So, you know, it's a matter of personal choice. A lot of women, you know, in the final analysis, they need to know exactly what they want. And if, you know, your husband or whoever your mate is, if he likes you, you know, decorate. Personally, I find some people look like circus clown. I've been very honest. I find that is, I don't understand. I really, really don't understand it. And as I say, from a health perspective, you need to be very careful. It's not to say, yeah, you can end up in some problems. So Dion, I don't know who you have that is wearing makeup or not wearing makeup.
Mr. Boss.
But if I guess I'm like, they're going to say you and Batson troubling these ladies. And somebody say, oh my God, I'm the lipstick queen.
I see ladies with them, you know, the eyeliner and the very large eyelashes, and I'm just wondering, you're talking about eye health. I'm just wondering,
if those things going to,
because I guess they're using a kind of glue to stick the eyelashes on. Yeah. That's what they're doing.
I thank God every day that I'm a man, and I don't have to go through that. Man, I always tell people that makeup. I think when I was younger, and you know, like when I was doing little advertisement and little one or two things, you know, I used to. Them days I was good looking. You know, they would put on little.
One set of comments
when I was good looking, you know, so I do little one or two little ads and thing. And I remember when they would have to put on, you know, just some powder on your face, as they call it, powder. And I was feeling like I was dying with this thing. I was feeling like my face was pasted down with glue or something. Yeah. And the thing is, when they would have to do the guys, you know, it's just a quick thing when we go, because if we would do with the young ladies, but those young ladies will have to sit down for like 2 hours. So I always used to be like, I glad as a man, we just pour on like this. And the thing is, when I was finished doing what I doing, I run and wash off that thing off my face so quick. Because it's very uncomfortable. So I don't know how women just make out with those things on their face for hours. Honest to God.
I think that's why they say I think it's a line they use, the cost of beauty or something like that. They say, I think there's a line that says something.
And that's what I tell you, when I was doing the research with what they were saying, and this was a serious thing, you know. I'm going to get the information close, because I did that research like some years ago. Something I was looking at, and I ended up finding that situation. And they were saying that men at that time in Europe, especially England and those places, if they married a female looking a particular way, and then after the morning or whatever, you're not looking how you're supposed to look, they could file for divorce. Because they were calling it entrapment. They say you were not looking like what it is the man expected. And now, I think now it's even worse, because, I mean, you have women, the hair ain't sure where, you know, according to my father always used to tell us, as young men, he says, when you're ready to date a young lady, the best thing to do, carry her in the sea.
That's right.
Carry her in the sea. Go and play, take a little ramp in the water, throw she in the water, you know. So if any weave, any eyelash, anything in that salt water that'll come out, you must know what you're dealing with.
That's right. And if she's saying, no, I don't want to go on the beach, I don't like beach.
Forget that. As Miss Shelley George is saying, a little enhancement is not bad, but some people overdo themselves. Some actually wear a broom on the, and I totally agree. That's what I say, you know, a little thing wouldn't, you know, it can highlight, accentuate what you have, but some of them is overdo it. They really, really overdo it. Really overdo it.
They don't want to do nothing with water. Nothing in no pool, no business.
Yeah, nothing with water. No, you can't. Yeah, you can imagine you carry one of them in the sea, and you get some good waving maracas in that water. The eyelash come off, weave come off, everything. When you're done, you're saying, nah, girl, what is this I was dealing with here? I get saved.
She gets it on any car because she's unrecognizable.
You understand?
Who is you? Right, so
this clap, we just will go to Tom and Dr. Batson. They'll say Dr. Batson.
So just speak at the same time. All right, so let's see here. Someone asks, Hannah, sorry.
Just 1 second, Dion. Hannah Alexander say you have water-resistant makeup. Well, look, thing. Well, I didn't even know that.
You're in trouble. You're in trouble. Dr. Batson,
yeah. You gotta get power hose. You gotta get power hose and put it on the face.
Come up with something.
Power wash some of them.
That's dangerous, man. Someone is saying here, premenopause causing fluctuating high blood pressure.
Mm-hmm.
Some days good, some days not so good. This is one of the not so good days, somebody saying, and I feel, oh, this person said they fell off a ladder. Oh my goodness!
Whoa.
All right, so that can cause all of that, Dr. Batson.
The person said they fell off a ladder.
No, the premenopause.
Oh well, premenopause usually causes a lot of problem. Premenopause could cause the following symptoms: fluctuation in blood pressure, anxiety, depression, muscle weakness. You feel very weak in your legs, insomnia, irritability, emotional upheaval. So you cry. These people will be in a wedding or in a joyous situation and they just cry. But it's usually because of the hormonal imbalance. And we could deal with that. I mean, I have successfully helped a lot of women with postmenopausal situations. And that's why we had gotten the Nerve Restore. Because Nerve Restore, I decided to get that product simply because, I'll leave my phone on, my apologies. Nerve Restore is a product that we basically did to help persons with mental and nerve issues and problems, sleeping and that type of thing, which would normally be a lot of the symptomology that women who are postmenopausal will experience. So hence the reason. I remember going to St. James' office recently, and I went and I was speaking to her. She never met me before. She would have dealt with Mr. Green and Mr. Bastamante. And she said, well, Dr. Batson, this is the first time I'm meeting you. But what she said, she listened to the program and she heard what I said about the Nerve Restore. And she started using it because she had problems sleeping. And it helped her significantly. But what it also helped with, it helped with the anxiety and the depression. Because that was some of the symptomology that she was also experiencing. Someone is making a very valid point here. Ms. Suzette Dempster is saying irregular heart palpitations also. Yes. No, Nerve Restore is not a liquid, Miss George. It is actually a capsule. It is a 1,000 milligram capsule. And it has 30 in the bottle. We normally recommend you use one a day. If things really, really bad with you, then the first bottle you're going to have to use 2. We normally recommend that you use it before bedtime. In some cases, some people would feel a little nauseous or something with it. So in that case, we recommend. I find when you use it with breakfast, that's one of the best times to use it, either with breakfast or with dinner.
Okay, let me just ask this. Okay, so someone is saying here, good morning, Dr. Batson. My question is, is it fistula?
A fistula, yeah.
A fistula be cured without surgery? If yes, do you have any medication for it?
Fistulas can be corrected without surgery, but it depends on how bad the fistula is. So a fistula is basically, how could I describe this, boy? So it is something that someone would get very close to the rectal area there. So like if this is the rectum here, what you have is that this piece of tissue here it's open or it's dislodged. So the tissue is opened like this. And what happens, because of that opening, bacteria and pathogens can go up in between there and cause serious infection and that type of thing. So what I'm saying, there's a product that we carry, which is a gel to apply in that area. It usually helps with hemorrhoids as well too. I suggest you try that. Sitz bath usually works as well. A sitz bath is where you could put like Epsom salt and baking soda in a basin, and it must be inside of there enough, you dilute it, and you actually sit inside of it. And that could actually help with the circulation in that area, cleaning out the area, that type of thing. If you try those and the gel that we carry, which is a silver-based gel, which you know silver is one of the most potent natural antibiotics in the world, it also speeds up wound healing and healing in the body. I would suggest you try that first. If you try that, and you also need to look at what you use internally, so you don't want any processed food. Try and use more greens, more living food. The advanced chlorophyll is something you could look at. You could look at the silver or the mineral formula to use internally. And once you use those, you should get good results. But as I said, it depends on how far along the fistula is and how long you may have had it. But generally, I believe you should try those first.
All right, so we have a call on the line. Hello, good morning, welcome. Hello, good morning.
Morning. Hey.
Hi.
Oh, okay. Good morning, dear. Good morning.
Good morning.
Good morning, Dr. Batson.
Good morning, my dear. How are you doing?
And I hear how you and Dion with your mascara and your makeup give my 2 cents.
Go right ahead. Let me hear.
You want to hear?
Yeah.
You want to hear?
Yes.
I know you're Dr. Batson with the makeup thing. You want to share a little bit here?
But I thought you are a natural woman. Didn't you say that before?
Yeah, natural. Natural. Most men eyes like to wonder, you want your woman natural, but why are you looking at the other woman on the outside? What the hell was the natural makeup and thing, huh?
No. We're just saying, as we say, a little enhancement is okay, but some of them just overdo it. That's all we're saying. Are you one of the overdoers?
I feel she's overdoing.
Yeah.
Susanna, you're overdoing. Yeah, see, look, she's not feeling.
So Susanna, like, I'll come and take you out on a date, girl. Let me see what I'll get. I'll carry you on a date. Let me see what will happen.
Coming and taking me out over and over again.
Well, we don't know, depending on how the first date go.
I can't show you because I can't swim.
Oh, that's an excuse. Yeah, what she said?
She can't swim.
She will have to stay this shore.
She can't swim. I hear you. Don't worry, I could swim. I will carry you out and bring you back.
This morning, Dr. Batson, my dog.
Yes, my dear.
Well, you know my situation, right? With surgery and so on.
Right.
But then we took my right leg, Dr. B, and I cannot stand up straight on my right leg. I can go up to a certain height,
right,
and the knee doesn't straighten up.
Okay.
And it's kind of painful. I've been drinking the circulation tea. It's been helping somewhat.
Right.
But not. Right? So what you do, Dr. B?
I feel I need to send you Maracas St. Joseph by the chiropractor.
Once you come with
Yeah, that's no problem. I will accompany you.
Send me away. Come and pick me up.
And carry you.
I like last spirits. I don't like Maracas.
I hear you, Miss Baby. But on a serious note, maybe you really need to check a chiropractor out, and we could get, because some of the nerves, a lot of times what has happened to persons, because the circulation tea and those things will help. But if it is a structural problem where something is out of place, then we would have to manually put it back in place and then continue feeding the body so that the body is not going to heal what the repair has started. If you understand what I mean. You know?
Yeah, but what happened is, doctor, when they did the surgery, right? They studied anesthetics in my lower spine, right? Area. And he said, that's the right leg. And I couldn't move it. He was like, good. Not the doctor, sorry, the anesthesiologist.
Right.
So when the doctor came, he's like, why did you do that to her?
Oh my God.
I wanted her to put her to sleep.
Right.
So since that now, the leg is just like dormant. You know.
But what was the surgery that they did? Knee replacement?
No, what I spoke to you about, I don't want to say it on air.
Oh, okay. Oh, sorry. Right. Sorry, I don't remember. Right.
Yeah. So when they did this, when they gave me the anesthetic,
right,
I wanted to make sure that everything was quote unquote dead at its root.
Right.
You know, so he said, lift the right leg.
Right.
I couldn't. And the guy said, nice, good. But when the doctor came to perform the surgery,
right,
he said, why did you guys do administer the anesthetics this way?
Right.
I wanted to put her to sleep. So, this is last September. And today, I'm still having issues with the right leg. I can stand up, but I can't walk on the right leg right now. I'm doing the exercise or what have you.
So, so let me ask you something. How much would you say the circulation tea helped you? How it helped? It helped what, 10%, 20%?
The circulation tea, at first when I first came out of surgery, I didn't have the strength to even pull myself up. But now, in circulation, I'm able to pull up myself,
right,
move around and so on, assist myself in the bathroom and that type of thing. So it is helping.
Right.
But my concern is I don't want my knee to freeze up
on you.
I can't use my right leg anymore.
Right. I understand what you're saying.
But circulation tea has been helping. It has been helping. That and the eye tea is what I drink regular.
Right.
And it, thumbs up.
Okay, good. Okay, well, here what we'll do. You will message me on the 314-9975 number, and I'm going to provide some information for you, and we will solve that problem.
Okay, that's you see why I love you guys?
Thank you so much.
She So she could deal with Dion and a different thing.
But it's not like that. It's you and Dion.
Yeah, Dion is the bad influences. He.
Good thing, Dr. Batson. Yes, blessings, my lady.
Take care of yourself.
Good thing, Dr. Batson. Not something for bad influence. Let me see here.
Let me just answer this question quickly, Dion. Michelle George on our Facebook is asking. She said, when I wake up on mornings, my both hands are dead, a lot of tingling and numbness due to a previous injury. Do you think nerve restore will help me? And that's Michelle George asking that question. The nerve restore will help, but you'll need to use other things as well. First of all, you need to look at your water intake. So I would suggest you use at least some of the alkagen water. The inflammation formula will help you in that situation as well. The nerve restore, and there's a product we carry called Optimizer, and some of the circulation tea. Either circulation or Hawthorne tea would help you in that situation. All right, so that was Shelley George. Okay, good. So you could go ahead, Dion.
Right, so let me just, it's a voice note, so I'm just going to play the voice note.
And she's asking Dr. Batson, can I open the capsules and mix with water or tea? You can, because if you have problems swallowing, there's no problem. You could actually mix it in the inflammation formula and drink it. Yeah, Dion, sorry, go ahead.
All right, so voice note.
Good morning, Dion and Mr. Batson. Just a question, please. I've noticed recently, as I'll be using my phone, I have one phone in my hand. The phone is in my left hand, but I've seen another phone on the right. And low in my eyes. Can you tell me what that is about, please? And what is the treatment? Thank you. Have a blessed day, both of you. Bye.
All right, so you want me to play it one more time, Dr. Batson?
No, I understand what she's saying. She says she has a phone and she's holding it in the left. And she knows the phone is in her left hand, but visually, she's seeing like if there's a next phone in her right hand.
Okay.
So it's like a sort of double vision situation.
Yeah, definitely.
Yeah, that could be early signs of macular degeneration. There's something known as macular degeneration, which is degeneration of the macula, which plays a significant role in sight. Now, the thing with macular degeneration, there's age-related macular degeneration, which, people say, well, you're getting older. But, I am of the opinion that a lot of times, yes, you're getting older, but if you take very good care of yourself, you could gracefully age. And with your eyes, I think it's something that would help. The eye optics formula would definitely help with that. What you also need to do is look at your bright orange colored vegetables. So I often tell people pumpkin, and I was actually doing some reading recently, and they were saying that people in the blue zones are where people live to be centurions. They live 100 and more. And one of the main foods that a lot of them use is pumpkin or squash and those type of things. So I think your diet needs to have more bright orange colored vegetables in it, your little carrots, those type of things. And from the supplemental perspective, you're looking at the eye optics formula. You could also look at the Optimizer. Optimizer is a very good product for the eyes because that product helps to improve circulation in the brain, and it's also a free radical scavenger. So we found a lot of persons get a lot of benefit with that, with their eyes. So that's something that you could look at getting, and we have that at any one of our offices.
Beautiful. Let me see here.
A blessed morning to Sky 99.5 family. Dr. Batson, I'm calling to find out on behalf of a friend. A friend had done an extra whatever onto her chest, and she said they told her that she have an hernia. But what is really going on is she says she's getting a lot of gas on her stomach, and she's burping, and she feel her belly is moving up, when she know that it is gas. So what can I tell her to use?
Okay, do me a favor. Okay, play that one more time for me, because there's something said about a hernia. So I was trying to get the hernia in relation to what she's saying with the gas. So just play it one more time for me, please.
A blessed morning to Sky 99.5 family. Dr. Batson, I'm calling to find out on behalf of a friend. A friend had done an extra whatever onto her chest, and she said they told her that she have an hernia. But what is really going on is she says she's getting a lot of gas on her stomach, and she's burping, and she feel her belly is moving up, when she know that it is gas. So what can I tell her to use?
Okay, I don't understand. Because when she said a hernia, she said she did a chest x-ray. I was like, well, how you could see that you have a hernia from doing a chest x-ray? But it's the type of hernia. She has what they call a hiatus hernia. And a hiatus hernia is when the esophagus sphincter doesn't close off properly. So that stomach acid regurgitates. So she's going to have a lot of bloating and gas and those type of things. So structurally, she's going to have to get that seen about. And then from the supplemental perspective, you're looking at, there's a product we carry. The Santulan will help, the Alkagen water will help, the Digestive Balance, Digestive Restore will help. So she could always call, and I could give her the number for a chiropractor who I usually recommend a lot of people to go to. I am quite satisfied with him. As I tell people, I could only recommend what I know. I can't recommend who I don't know. And I believe she will get help. But that is what it is. It's a hiatus hernia. And that's, you know, the old people are saying you have NARA. That's basically what it is she has, right? And or when people say your butcher drop, that all those things are sort of related. So that situation needs to be manually corrected. And then, of course, from the aspect of correcting the excess gas and acid, you'd have to use things like the Alkagen water, Santulan. There's a product we carry called Digestive Restore. We didn't have that for quite a while, but we started getting back. Very, very good product, because that actually works in helping your digestive system from its base. So it has some prebiotics in it, some probiotics. A very good product. So that's something that you could look at getting.
All right. Someone is asking, Dr. Batson, can this nerve restore be used for persons who are bipolar and depressed?
Yes, they can. It can be used for bipolar persons. In fact, someone on... Yeah, you can use it for persons who have bipolar disorder, persons who have things like depression, anxiety, those type of things. It would definitely help them. The good thing about it, it would not react with any medication that you're taking. Okay, and there's someone is saying that she actually used the nerve restore. Let me see if I can find it. Miss Marcia Lectrin. She says, I'm on the second bottle of nerve restore. It works very well for me. I sleep good now. That was my problem, and I drink lots of tea, no sugar. It's okay. All right, very good.
Okay, so you want me to go forward?
Yeah, you go ahead.
Okay, so I'm playing this voice note. A voice note again.
Hello, good morning.
Good morning to the host, Dion, and Dr. Batson. I'm just calling to find out something this morning. Could you tell me how long shingles will stay in your system? And what can you do to deal with the pain even though the rash is dried up? It happened to my mom. She's 72 years old.
Whoa.
75, sorry. And could you give me a feedback on it? And number two, could you take the supplement Toxins 200 milligrams? Could you tell me? Thank you. Have a good one. Bye.
Bye, thank you.
Okay, very good question, man. The thing is with shingles is a dangerous thing. Yeah? It's dangerous in the sense too that I always believe, and this is not me trying to be. Shingles is something you cannot only deal with Western medicine, because I mean, what are they going to give you? Antibiotics. What I have found with persons who have dealt with shingles, you need to get the inflammation formula will help, the silver or the mineral formula would help. We also have the silver that could be applied topically. That is also going to work as well. Because you see, what happens with shingles a lot of the times, it doesn't leave your body entirely. Yeah? Depending on the protocol or the regime or the antibiotics that you may have been given, it actually could stay there for quite a while. So that's something that I would recommend. The Alkagen water, you said the person is your mom. She's 75 years. So I don't know what the water intake would look like. She definitely needs to increase her drinking of water. Leave out any sugary drinks, so things like soft drink, juice, leave that out for a little while so that the body could heal and repair itself very quickly. And as I said, not necessarily Santulan so much, but the Alkagen water inflammation formula, the silver with the mineral formula, and the silver to be applied topically. And I believe once you use those, you shouldn't have a problem. From the dietary perspective, you want more complex carbohydrates as opposed to simple carbohydrates. So you don't want things like potato, rice, pasta. Try and use a little more provision if you're using rice, brown rice, things like quinoa, that type of thing. So you know, more living food. And try and take sugars out of the diet, because sugar is going to fuel something like that, right? When you use a lot of sugar, it seriously impedes your and make your immune system less effective. It actually opens up your immune system and make you, or not open, sorry, but reduce your immune function. So it becomes very easy for pathogens to actually get in and cause serious problems. So once you do those, you shouldn't have a problem. As regards to the CoQ10 200 milligrams, she said, that's not a problem. That's not a problem. I'm a big advocate of CoQ10. I use it personally. I recommend it for a lot of persons because it is very good for your heart. And it does some interesting work with your liver as well. So definitely you could go forward with that.
All right, someone asks here, morning, Dr. Batson. My sister-in-law has, it looks like autosomal dominant polycystic kidney disease.
Ooh, yeah, that's some work. But we could fix that situation, man. Sorry, go ahead.
Okay, she said she had to do an emergency surgery to remove a kidney on Thursday.
Whoa.
As one of her kidneys were bleeding. She is presently recovering.
Whoa.
Her children, ages 18 and 29, did a test on Friday. The test showed that their kidneys have traits of the disease.
Mm-hmm.
Is there anything that can be done to reverse this, or do you have products to assist them as it's in the early stages? Thank you.
The thing is, that's a very serious kidney condition. I'm sorry, the person didn't get on to me before they had to do the surgery, because I've helped persons with that situation already. The thing is, your kidneys are a very funny organ. Eh? I always tell persons, of all the organs in your body, the kidney is the organ that could give you, it is a very, what's the word I want to use for you? It is an unforgiving organ. Let me put it like that. It is very, when it starts to give problems, you have to know exactly what you're doing. And this is not any boast. You know, I've been able to help so many persons avoid dialysis when I get them early. Persons I've been able to help persons on dialysis. There are persons who came to me on dialysis who wasn't urinating. And when we started working with them, they actually started passing urine, which is a big improvement, because you don't even see that. So, you know, we could help persons with the kidney situation, even in instances where you are told that this particular imbalance in the body is a genetic one. Because we know genetics, as we always say, genetic loads the gun, but lifestyle pull the trigger. So, yes, we can help the children in that situation. We could also help you, because you have one kidney now. So, of course, you're going to have to try to be very diligent and, you know, pay attention so that, you know, you don't lose that one, because then you're going to be in a lot of problems, right? That's going to mean that you're going to have to go on dialysis, which is not a walk in the park for anyone. It's why I tell people dialysis is one of the worst things a human being could have to undergo. Persons could die on that machine while they're being dialyzed, because your blood pressure can go from very high to very, very, very low in a matter of seconds, and then that's it for you. So the answer is yes. Off the top of my head, Optimizer is a product that helps with kidney problems. The kidney tea is also a very good product as well. There's a stem cell product that we carry as well that works very good in that situation. So I would just have to design the protocol accordingly, and you would get some maximum benefit from that. As I said, I'm really sorry that, you know, I wasn't aware of the situation before, so that we're going to help save that kidney that, you know, that they had no other choice but to remove. Okay, so those telephone numbers, you could give us a call on 222-8261. That's 222-8261, as well as 314-9975. That's 314-9975. And that number for DB is 223-7515. That's 223-7515. And those locations, we are located on the first floor of Money Talks building. That is Money Talks building in Montrose, Chaguanas. We're also on the corner of Ramsamouche Trace and the SS Erin Main Road in Dede, as well as Red Edge Mall, Western Main Road, St. James, and the Triangle Building in Scarborough, Tobago.
Dr. Batson, if someone wants to get in contact with the St. James office, what number are they calling?
St. James number is 220-8113. So that's 220-8113. 220-8113.
Okay, beautiful. All right, so let's go here. Someone is saying, okay, just now. I need some time to pronounce that word. So let me go to the next question.
All right. Well, before you go to the question, let me just mention this here because I'm trying to deal with Facebook persons as well. So Ms. Patricia Patton is saying, good morning. How can we use the MSM drops? And the MSM drops usually, if it is you're taking the MSM and the eye optics, you use the MSM first. So you shake it up and you put 2 to 3 drops in both eyes, and you do that an hour before the well, not an hour before, maybe like about 15 minutes, 30 minutes before the eye optics formula, and you do that morning and night. If you're using the Sincera eye drops from us, well, then you do the MSM first again, 2 to 3 drops in the eye, 15 minutes to 30 minutes before the Sincera. Okay, Miss Patton? Yes, the answer.
All right, so this person, oh, okay, so they were saying thank you for the blessing. All right, so let me take this voicemail right here.
Good morning, Mr. D and Dr. Batson, Double D. I just want to find out something. Can you tell me what causes at nights, whenever I go to bed, I have a cough. A cough appears like a dry cough, but in the daytime it's not there. It only happens at nights when I go to bed, or basically I'll say from any time, minutes to 10, after 10 in the night. And then I want to fly down and sleep and I cough. And then during the daytime, when I rise in the morning, it's gone. You tell me what you think the diagnostic can be and a solution, and if you have any product for such.
Okay. The thing is, usually that could be, well, I don't know if you sleep with air condition or if you sleep with a fan on you. That could be a contributing factor. There's something known as a postnasal drip. And postnasal drips usually give problems later in the evening because the temperature is, the place is cooler. So it possibly could be a postnasal drip where you have this just dry cough, but it manifests itself later in the, at the hours when the temperature is much lower. As I said, take into consideration if you're sleeping with AC, if you're sleeping with a fan on you, that could also contribute to that situation as well, right? When you're talking about postnasal drip, it means that you got the cold at some point in time and the infection didn't go completely. And what you have now is to the back of your throat, you have this dripping sensation. As I said, usually some people who get that, they would have it for the entire day, but some people, a lot of times, it happens later in the night into the morning, which is basically what you're saying, because it saves like from about 10 to maybe about 5 in the morning, somewhere around there. As regards to what we have for that, there's a long stay we carry that will give you some help. The Alkagen water together with the Santulan. Santulan is a 7-channel detox. So even if you use 1 pack of Santulan, 3 bottles of water, and you get some of the long stay, I believe you'll get some good results with that. If it's still persistent, well, then you're going to have to use the silver or the mineral formula. And why I like that silver is because, as I said, I tell persons, it is a natural antibiotic that, it helps and it works throughout the body. The thing with silver takes 8 hours to exit your body. And it doesn't affect probiotics, so it doesn't affect the healthy ecosystem in the gastrointestinal system, nor does it affect tissue. And that's what makes it, one of the best antibiotics to be used. It's a natural form of antibiotic that wouldn't cause any long-term damage to the body, as opposed to if you're using things like augmentin, amoxicillin, and those type of things. So that's something that you need to, I believe once you do that, you should have you should get some results. What I suggest you also do, stay away from cold drinks as much as possible. So try and have your water room temperature. Try and introduce more hot teas into the diet. So as I said, things like the long tea going to help. There's a tea that we carry called Puer. That's a very good tea as well. Dandelion is also good as well too. We carry that too as well. And with your tea, no milk, no sugar. I believe once you do that, that should be a thing of the past.
Beautiful. We have another. Good morning. Can turmeric be used every day if someone has stage 5 kidney disease? Can someone take baking soda if they have stage 5 kidney disease? If yes, how do they use it? And a low-carb diet, can a low-carb diet help kidney disease?
Okay, so if you're saying that you have stage 5, so which means you did an ESR, which is the erythrocyte sedimentation ratio, and they're saying that your kidney has reached stage 5 in terms of its ability to filtrate, the filtration of things like creatinine, bond, that type of thing. The thing is, turmeric, no. You don't use that. That turmeric going to make that situation worse. Simply because, especially every day, no. You can't do that. Don't do that at all. That's going to put you in some problems. The baking soda, however, you need... You see, what I have to find out from you two, in order for me to give you a proper piece of advice, I'm going to have to get more information. Because if you are hypertensive, which I possibly think you are, if you have stage 5 kidney disease, you have to be careful with the baking soda. Now, there are things that we would use for persons with kidney. We carry a kidney tea, which I've been using that product for years, in excess of 10 years with my patients, clients, and they've gotten very good results with that. But what I'm going to have to see, your kidney function test. So I'm going to have to see the creatinine, the bond, the GFR, those type of things, and then I'll be able to guide you better. I don't want to just off the top of my head say something and put you in more problems. I know off the top of my head, definitely the kidney tea would help, but I need to get more information as regards to your blood pressure, those type of things. But the turmeric, definitely, that's a no-no. Don't do that. That's going to put you in a lot of problems. Your kidney cannot take that kind of pressure right now. All right, so if you could at least message us on the 314-9975 number and give some information there, and my staff is going to pass the information on to me. Monday, where am I working, boy? Monday, I should be, I'm working at St. James. Yeah, so the next time I'm in Shogunas would be Wednesday, God's willing. So if you could send that information, 314-9975, WhatsApp the information, then I would be able to contact you, whether we have to do a consultation over the phone or something, and I'll be able to guide you better. But I need to have some other information. All right. So again, those telephone numbers, 222-8261 or 314-9975. That's the WhatsApp number. Daybase number is 223-7515. St. James is 220-8113. And Tobago is 226-4553. That's 226-4553. Keep in mind, we do have that special still with our blood analysis, our magnetic resonance analysis scan, so you could also take advantage of that that situation that we have there. Keep in mind, too, we also have Nerve Restore special for this month. So those of you who may not have it, who may have been thinking about using the product, who have a problem with sleeping, you have a little anxiety, you're working in a very stressful environment, you're always stressed out, that's a product that you should look at taking. However, keep in mind, your water, your hydration is very important. You should be drinking your body weight divided by 2 in ounces for at least the last month. If you're not doing that, I suggest that you use the water first and then start to use your Nerve Restore. You will get better results like that. Okay?
Okay, Dr. Batson, someone is saying, just wanted to know what time do you open in Redditch Mall if you open on Saturdays? This person has said I went late last week Saturday, but they
were closed. Yeah, Redditch on a Saturday is 10 to 4. We would only go longer if I'm working there on a Saturday. I think there's some Saturday that I'm supposed to be working, maybe 2 weeks from now or something like that. So if I'm there, we usually have more consultations and blood and whatever the case may be. But generally, it's 10 to 4 o'clock. And the other days, it was 9 to 5 during the week.
Okay. Let me see here. Someone is asking, hi, good morning. What causes chills with no fever? Could it be that I am lacking some sort of vitamins? And at times, my eyes hurt along with slight blurred vision and aches in my left hand. Sometimes my throat feels tight and acidic.
There's a lot. There's a lot.
Okay.
So need overall.
Yeah, at times my neck feels tight and my throat feels very acidic. Yeah. Could you just share anything on that, please?
The thing is, normally what I tell persons, when you have a lot of problems in the body, like what that person is saying there, because they have chills, so it's musculoskeletal, it's nerves, is the eyes as well. Sometimes you just need a good detox. So once you're not feeling weak or excessively weak, I suggest you use the alkagen water and the santulan. What you should do is that if it is you have a slight bit of weakness in the situation there, then I would suggest the silver or the mineral formula, the alkagen water, and the inflammation formula. And you could throw in an optimizer in there. If the eye is really giving you a problem, then an ioptics formula. Because ioptics formula is a product that actually helps to improve circulation and oxygenation in the eyes themselves. You know. What a lot of persons do not understand is that a lot of chemicals enter your body via your eyes. You know. So I always tell persons who work in oil and gas, people who are painters, people who are auto mechanics, if you are a welder, and for God, no, these men are them very hard and they don't listen to nobody. Why, I don't know. If you have I don't know if they have an early desire to die earlier than they're supposed to or what. But if you know you're involved in those type of fields, you need to get an eye drop. If you don't feel to buy an eye drop from Batson, that's no problem. But I'm telling you, the eye drop will help you. Because you can't be doing hairdressing, you can't be a welder, you can't be doing auto mechanics, you can't be doing straightening and painting and not taking care of your eyes and other parts of your body. You need to do cleanses. If you don't do that, I'm telling you, you're going to get some sort of cancer diagnosis. A lot of persons who have dealt with lung cancer. I remember dealing with a lady some years ago. It was a real, that was a heart-wrenching situation in the sense that she said, Dr. Batson, I didn't know. This lady used to do tie-dye and batik.
Right.
And she got lung cancer because of that. Remember, you're dealing with dyes, you know. Any job that requires you dealing with, there was someone who I dealt with too, people who deal with preservatives, who make preservatives. So if you know you're making red mango and red plum, and remember you're using a lot of chemicals. They have to use things like sodium benzoate, potassium sorbate, and all those type of things. A lot of the times they're not going to put on gloves, even though they're supposed to wear gloves. But when you're doing your thing, hurry, they go on and they push their hand inside of that. Remember, anything that goes in the palm of your hand, go into your bloodstream. So you talk about sodium benzoate, potassium sorbate going in your bloodstream via your skin. It's the same with men who do mechanics. A lot of the time they ain't wearing no gloves. I know mechanics used to wash their hand with diesel. There's something on the market. It starts with purple, or they'll finish the rest. When people just use that on the skin, that is going to go inside of your body. So you need to do your regular detox. You need to clean your body out. You need to drink a lot of water, because I am telling you, you're going to somewhere down the line, you're going to end up in problems. And you're going to go to some dotish doctor. And I'm not even apologizing for that, because some of them are very dotish, and they're going to tell you something contrary and not tell you that it's because of what you was doing that you end up in that situation and go and recommend some kind of nonsense to finish kill you. You have to understand that you cannot be working. The thing with this country, we do not have a proper health and safety, nothing in Trinidad and Tobago. I don't care what anybody say. Our health and safety is ridiculous. They're trying, but they're no way up to standard. They're no way up to standard with masks and proper. Look, I see people just be going up on scaffolding and they don't even have a harness. You think you could be living in the United States and you go up on top of scaffolding without a harness? You mad or something? Man, the amount of lawsuit them people will be getting. But in Trinidad, you go up on scaffolding. You know how much people you know fall off a scaffolding and fall off a ladder and all those type of things. And then sometimes the fault is your own, no. Because you know you're playing macho and your thing, and you know, well, I'm going up on the scaffolding and nothing will happen to you. You can't say that. You can't say that. Because you go up there, you fall down and mash up your back. What's going to happen to you now? So an ounce of prevention is better than a pound of cure. And a lot of people in certain industries do not pay attention to yourself. You're going to wait for whoever you're working with to a lot of their health and safety not up to scratch. It's not. I mean, I'm not trying to be controversial, but it's not. In the final analysis, when you work in certain industries, you know you're working in oil and gas, you know you're working, well, we do have petrotrin again. How many persons who work petrotrin, how much years? Check where they die from. The people and them go home, they was good, and then they just die just so. You think it's just to the dead? It's something they get. In some cases, some type of cancer or some kind of. So you need to be careful. Once you're working in those industries, you need to do your regular detoxes. You need to do your regular cleanse. And you have to do that for yourself, because management ain't going to tell you, drink no baking soda and drink no santulan and drink no alkagen. They're not going to tell you that. Because the doctors that they're listening to don't know anything about what it is I just talk about there. Because I have dealt with persons from police, army, and I see some kind of report some doctor give them and tell them they're good. And when I finish test them, people, they're looking like they're ready to dead tomorrow. So I don't know what standard they're using. It's not the standard that we use. Because I am the type of person, with the medicine that I do, if we are the type of people, we're going to pick up early warning signs. as I always tell people, an ounce of prevention is better than a pound of cure. So you want to be working in some factory, you're working somewhere, they're making cement, they're making this, you're working in a place where they deal with vehicle and all kind of thing. And you inhaling that every day and you want to wait for somebody to tell you have cancer, as opposed to you being proactive and take care of yourself. Come on, man. As a wise person once said the other day, you're big and you have sense. You need to use your brain, man.
Definitely.
Yeah.
Let's take this call. We have a call on the line. And Dr. Batson, okay, could you just lower your radio for us, please? Just take your radio way down so we could hear what you're saying. We don't want to miss what you're saying. And Dr. Batson, I sent a message in the chat, in our chat here. So you can just get...
you sent a message to me on WhatsApp?
No, on this chat that we're using here now.
Okay, good.
So maybe I forgot his name right there. Can maybe check it out for you.
Okay.
Right. So let's hear on the line. Hello, good morning, welcome.
Yeah, good morning to you and Dr. Batson and the listeners. Dr. Batson, I bought oolong in a big pack. How much water and oolong should I use?
But the big pack that you bought, they didn't give you a recommended dosage?
They don't know how much to use.
Okay, that's strange though. But what I tell persons, when you get teas that loose like that, I would suggest you use 1 teaspoon, a proper teaspoon, measure in teaspoon, not small spoon, right? And you put it level and you put it in like anywhere between 8 to 12 ounces of hot water. That should be good.
Okay, thanks. And ma'am, what is a good pressure? This morning, man, 114/71, and the pulse was 67.
114/7. Yeah, that's a good pressure.
And how you does what the bottom part is the one you don't have to consider more?
Well, in some instances, there are some persons, your systolic is your top number, your diastolic is your lower number. Why the diastolic is usually cause for concern is that if you have a diastolic over 80, but if you go 80, 85, we wouldn't kill you for that. But once you start to go over 85, then that's cause for concern because it means the heart is in some trouble. But once you get in, you say you get what, 114 over what? Over 60, was it 60?
71.
No,
114 over 71 and the pulse is 67.
No, that's a good reading, man. That's a good reading. Okay. All right, so with the oolong tea, use 1 teaspoon.
Okay then.
All right. You're welcome.
All right, thank you so much for calling. So I sent a message, so maybe he can show you, Shaki could show you the message.
Show me the message, okay.
Yeah, so you can see what's going on. All right, so this person sent a voice note, so let me see if I can play it here.
Good morning, Dr. Batson and Dion. I would like to ask a question. First of all, Dr. picked me up insulin and the hypertension tablets, all because of the starter diet with fruits and vegetables.
Very good.
But the problem is that the circulation still bothers me a little bit. But I want to know how long does it take, even though you're not taking any insulin anymore and stuff like that. Even though that is happening, how long does it take for that circulation to come back into your body? And if you do have to take something besides the circulation tea, do you have any other thing that you can take to help it also?
Okay.
I don't eat any meat at all, and neither no rice or no flour. But sometimes I will just put in a little ramen into the vegetables. Do you think that this is the ramen? I thought it's still flour causing the circulation to bother me.
Okay, so all right. Okay, so the doctor took her off of insulin and hypertension medication because she changed her diet and she started eating fruits and vegetables. That's excellent. She's saying now that she still has problems with the circulation, so she wants to know what to use. The thing is, if you want insulin for extended period of time and you have diabetes numbers reading, all over the place, the circulation is going to take a while before it comes back to how it really is supposed to. As regards to what you could use, you're going to have to, apart from the circulation tea, santulan, alkagen water will help you, right? What you're going to have to do as well is you're going to have to get, there's an omega that we use, but the omega that we use has astaxanthin in it. I prefer that as opposed to other omegas because I find it's like a double-edged sword in the sense that you get two set of advantages from it. Apart from it being omega, it also has astaxanthin in it, which is an antioxidant and also a free radical scavenger. Because I try to help a lot of persons with circulation. Now, the balanced circulation that we have, that's also a good product. And there's Circulation Plus, which is a liquid circulation product that we have. That could also give you some help as well. As regards to the that noodles that you're talking about, I wouldn't really put that in there. The meat, I wouldn't advise that you stay off from meat completely. Try and at least have some fish, maybe like about twice for the week at least, because you need to have your omegas, your protein in that whole aspect there. So you don't want to go complete cold turkey because you can run into some problems there if you leave out everything all at once, right? The fruits and vegetables is good. You need some nutrient-dense foods as well too inside of there. And once you do that, you should start to see some better results with the circulation. But as I said, circulation tea, balanced circulation. I don't know how your energy level is, how you're feeling strength-wise, because once you change your diet like that, you could experience some weakness. I don't know if that is happening. So once you're not feeling weak, then you could use some of the santulan and the alkagen water. And of course, you could also get a omega, and you use the thing when you're dealing with omega, you're dealing with EPA and DHA. So I'm very brand specific where those things are concerned. Of course, for the years that I've been in practice, simply because I believe everything that they have out there sometimes. When you think they tell you A on the bottle, you're really not getting nothing close to A. So that's something that you need to pay attention to. But kudos to you, man. That's very good. That's very good that you made that change, and keep it up.
Dr. Batson, were you able to see the message that was sent?
I'm trying to figure out. Let me see if Shakil could give me it. Dion, could you do me a favor?
Yes.
Could we just take a short break?
Right.
Because I actually have some santulan here that I need to drink. I should have drank it since an hour ago. So I'm going to drink that because I didn't eat with the intention of taking my santulan. All right?
Oh, no problem. And, so we can do that.
Yeah, we're going to take like about a 10 minutes break. And I was going to give you a song to play now. I end up finding a song. Yeah.
DJ Batson.
Just all over fine. I heard this song and I was so impressed. In fact, this artist, her name is, you ever heard of Mercy Chino?
Yes.
Right. This one has a very impressive voice. The name of the song is Chinidum. Tell me if you find it.
Okay. What you said the name of the song is?
It's CHINEDUM.
CHIN.
ED. E as in egg, D as in David, U as in umbrella, M as in mankind. So it's C.
We have that in our we have that.
Oh, yeah.
All right, no problem. I'll do that for you. All right.
All right.
Okay, blessings. Hey guys, thank you so much. You're listening to Sky 99.5 FM with Dr. Batson of the Batson and Associates. I see your messages. When we get back, we're going to take some more of your messages and take some calls. Keep this number 624-7729, 624-7729, 625-2759. Our WhatsApp number is 333-9950. That is 333-9950. And we're going to be back with more right here on Sky 99.5 FM. This is Sky 99.5 FM. All your gospel hits from yesterday and today.
Sometimes I wake up wishing I was someone else.
Twitter and Instagram. Search Sky 995 FM.
Always pray, keep the faith. You can face one more day. So let the sky is the
Inspire, empower. This is Sky 99.5 FM. Get ready for Lunchtime Doctor with Dr. Safia Mohammed every Monday to Wednesday. She delivers valuable medical advice and engage with you one-on-one to answer your questions, alleviate your fears, and provide the medical information you need to make informed decisions. Tune in to Vibe City 105 FM, Zangi 106.1 FM, Sky 99.5 FM, or Freedom 106.5 FM from 12 p.m. to 1 p.m. for your daily dose of Lunchtime Doctor. Brought to you by South Active Care, Caribbean Heart Care. Our heart is set on saving lives. CVU Optical, affordable eye care for everyone. And Soft and Pretty with total hygiene, your safety, our priority.
Medical Associates Hospital is a Ministry of Health and CARPHA-approved COVID-19 testing facility. At Medical Associates Hospital, we provide professional, convenient, and affordable COVID-19 PCR testing, COVID-19 antibody testing with results in 24 hours, and COVID-19 antigen rapid testing. With testing being done 24/7, you can be sure to have your results on time and in time. To schedule an appointment for your COVID-19 PCR test, please call 704-2075. Medical Associates Hospital, the #1 private healthcare institution in the Caribbean.
For the best healthcare experience, come to Batson and Associates. They're specialized consultants in natural and integrated medicine. They offer live blood analysis testing, MRA body scan, and food detox. Visit them at Ramsmooge, Trace, and SS Erin Road, Debe. Call 341-4813 or Triangle Building, Scarborough, Tobago. Call 270-2968. Call and make an appointment to see Dr. Batson. Get the expert care you need.
You muted her.
No, I muted.
Uh-huh.
When I say you, yeah?
Oh, okay.
Stop the song. So it's a box in let him see you again. Right. See you again, eh?
Okay.
And then music stop the music.
My life is for the glory, glory. Except you build a house, the builder builds it faith. Me, I'm a father, anyway, lead me, I don't know. My life is for the glory, your glory. You made the little things I do be like in a video. Your grace brings a difference. You'll never ask me, like me, I like the way you lead me
You're listening to Sky 99.5 FM, Dan Green and their company, along with the man himself, Dr.Batson of Batson and Associates. He is here with us, fresh from getting a dose of Santuan. Energized. He's energized, he's ready to go.
Anywhere you lead me, I will go. 'Cause you are the way, truth, and the life. Jesus, you never leave me, no forsake me. Except you build a house, the builders give you faith. Me on the phone, anywhere you lead me, I will go. My life is for your glory, your glory. She did, FM on a Sunday morning. It's a pleasure being in your company. Dr. Batson look different.
That's music for the soul, boy. Watch me. The first time I hear that song, I listen to that song about must be about 50 times a day, you know. Now I said that particular song.
Yeah.
Something I was doing on YouTube and I was looking through, playing music in the car going where I'm going, and that song came up, and I think I must have listened to the song about 20 times.
Wow.
Yeah, that's music for this. No, that lady, she good. There's one other one. When we finish the program, you'll play that one. And that's I decent. No, she good. Nice song.
Yes,
Somebody message me and tell me make the day with that request. Yes, so apparently I is not the only person who like the artist. But
yeah, man.
Good song.
She has a
Powerful voice, boy. Jeez.
Singer of Jesus, you love me so much.
Mm-hmm. Yes, that and the other one is the one where she did a performance with J.J. Harrison That was a
All right,
live
Jason,
performance.
thank you so much.
Yeah.
Yeah, man. That's the one. I'm gonna do that for you. Don't you worry. All right.
Definitely. All right. So back to the matter. So these people on WhatsApp, on Facebook, going clear. You know? What I know.
Working out with them on Facebook. There. All right.
Yes.
All right. So are you gonna take some calls, messages? So
yeah, let's take some calls again.
right.
One of the things to anyway, go ahead.
Yes.
I'm trying to facilitate as much people as possible.
All right. Did Shaquille get the question?
No, he said for some reason, because of how we have the phones engaged here, he was getting problems. So that's why I asked if you could have sent it on my personal WhatsApp, and I would have just give it to him.
Okay. Oh, that's what you had. Okay, so no problem. I'm gonna send it to you while they're dealing with the other questions. I'm gonna send it to you. All right. So this let's go to the question here. Someone's asked, "Good morning, Dion and Dr. Batson. Dr. Batson, my blood pressure is fluctuating. What can I do? I'm not hypertensive."
If your blood pressure, is fluctuating, but if it's something that recently started, that could be an indication of a number of things. It could be, I don't know if it's a female, and it could be some sign of PMS. If you're not female and is a male, well, then the possibility exists. It could just be you might just need a detox, you need a cleanse. One of the things I've found is anytime things start to go wrong in the body is usually an indication that you need a little clean out. Hence the reason why Santulan was born. I mean, there's a product that we carry, and Santulan is like the oldest product that we have. And it's a 7-channel detox. It cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. After Santulan, we got Alkagen water. Before, we used to use Kangen. But then, because of all this situation with people bottling pipe water for people I didn't want to be no part of that, so I basically had a brand specific to me and that I could be responsible for. And know once you purchase that, I could stand by what we carry. So I would say, a little detox. So you might need to check your hydration. Maybe you're not drinking sufficient water. Always keep in mind with anything that you're dealing with, a lot of the time, hydration is everything. So always check your water intake. The rule for drinking water, as I said on numerous occasions, is your body weight divided by 2 ounces. And once you're doing that for the last month, if things still out, well, then you might need to get a Santulan, maybe some of the silver, depending on what your situation is. And it's just a matter of resetting the body. I mean, it's like when you have a car, what it normally do. You have to change your filter, change, various things. So sometimes it's just an overhaul you want.
Definitely. You can give us a call at 624-7729, 624-7729, 625-2759. So you're listening and you want to ask Dr. Batson a question, want to make a comment, you have that time, right? 624-7729, 625-2759. So we have 2 callers on the line. Let's see who's there. Hello, good morning, welcome. Hello, good morning.
Hello.
Hi, good morning. Could you lower your radio for us, please?
Hello, morning.
Yes, good morning.
Good morning.
I just want to ask Dr. Batson something. If you have glaucoma in your eye,
Right.
is operation the only option, or you could get some eye drop or something to use?
Yeah, definitely.
Right. You had a question?
Yeah, definitely. You could get. I don't suggest you go and do surgery for glaucoma. Glaucoma surgery is usually the surgery that they have for glaucoma. Most of the time, they're going to put in something called a shunt. And usually after that surgery, you wouldn't be able to see again. You're not going to be able to. So why would you put yourself through that? Glaucoma is high ocular pressure in the eye. It means there's high pressure inside of the eye. So in order for that pressure to be high, something that I have seen somebody do, and it works. Now, I'm very cautious when I give people home remedies, because some of it is one overdo the thing and don't do it correct. But one of the things I know helps with glaucoma is you get a Wonder the World leaf, and you take the Wonder the World and you pass it a few times over the fire, right? So you let it get a little scorch, nothing too much. And what you do with it, when you wash it first, you do that. You make sure it's cleaner. And what you do, you close your eyes and you take the one that you will leave and you rest it on your eyes. So you have to do that lying down, right? So you take it and you rest it. What that has helped to do is actually help to pull a lot of the toxins from out of your eyes, right? So that's something that you could look at apart from the eye drops that we carry and that type of thing. Because glaucoma is a serious thing, but it is a fixable situation. But as I said, there are certain things in your diet that you need to take out. You cannot have glaucoma and want to be drinking coffee. That pressure will never go down. Because remember, coffee is a diuretic, right? It's not black coffee. I mean, the thing is, some people drink black coffee. If you drink black coffee once a month or something, we wouldn't kill it for that. But you using coffee with other additives and all kind of foolishness in it, that's going to increase the inflammatory response in the body and cause your glaucoma to get worse. So,
all right. So we take this call. Dr. Batson, do you put soft candle on that or just as is?
As is. You're not putting any soft candle.
Okay. Hello. Good morning. Welcome. Hello. Good morning. Could you just lower your radio first, please? When you don't lower your radio and you're listening to us on the radio, what happens is there's a feedback and we're unable to hear what you have to say. And we want to hear what you have to say.
Yeah.
Go on ahead.
Okay, good morning to you and Dr. Batson.
Morning, blessings.
My question is, I'm a middle-aged black man, my 50s. So I just want to know what natural products are there that I can take, plant-based or whatever, that can help increase my testosterone and the amount of zinc that I would need in my body, to maintain a healthy lifestyle.
Okay, good. The thing is, when you're looking at testosterone, there's something called low T, which is low testosterone, that a lot of men experience when they reach, some cases, 45, 50, 55, that type of thing. So from a natural perspective, there are some supplements that we carry for that. What I would suggest you use, try and include some beetroot in your diet. That would help. Green figs, also very good for that as well. Exercising helps significantly with testosterone. I don't know if you're a person who do any kind of resistance exercises. Squats is one of the things that is one of the major production, or causes your body to produce a lot of testosterone. It also causes your body to produce something HGH, which is human growth hormone, right? CMOS is something as well too you could look at. Now it depends on how low it is, and that's why supplementation comes in, because I was speaking to someone recently and he was saying, Dr. Batson, only after I listened to you, I started taking supplements, because he was of the opinion that he could get everything from his food. But you see, what I try to help persons to understand, because of how food is now, and because of the demands that we have on the body now, because our body under so much stress that 100 years ago, 200, 500 years ago, our ancestors didn't have to deal with the kind of stress we have, because we have environmental stress, we have all the type of chemicals. You see, for example, that landfill that was burning, however, you see the type of things that you have to inhale and that type of thing. So the thing is, we're living in a different time, and because of that, the body requires more. And what you would have normally gotten from food, you need to supplement your diet now. You have to muster bound to do that. But you need to do so under some professional guideline or guidance, like someone like myself, someone who trained as a consultant at Batson Associates, either Mr. Bustamante, Mr. Paul Green, or Ms. Karishma Ramdan, or even some of the assistants who work with us, because I try to make sure I train even my counter staff and front desk administrative staff, that they understand certain things as regards to the products, what it's for, how to use it, and that type of thing. Because the more they know, the better we're able to help our clients. So those are some of the things that you could use. Beetroot, the CMOS, exercising, plenty leg exercises, either squats, lunges, those type of things. Apart from that, from the supplemental perspective, there's something that we carry called when I remember it clearly, I'm going to tell you exactly what it is. But it is a supplement. I use it. And I have recommended it for a lot of persons, and they saw some significant results, because there are some injections that doctors would give you, but the thing with those injections, it would just boost your testosterone for that period of time, and then after, in a matter of days, it go right back down. You want to help your body to continue producing the testosterone properly.
Definitely. 624. Oh, wow. Okay. 624-7729-652759. I sent a message, right, Dr. Batson? So you should have it there. Hello, good morning. Welcome. Okay, so you need to lower your radio. Need to lower your radio for us, all right? Hello, good morning. Welcome.
Morning.
Yes, good morning.
I have white tongue, and I would like to know what causes that and what is the
Okay, ma'am,
yeah,
can you lower?
You gotta take off the radio.
Yeah, your radio is causing a lot of problems, all right? So,
hello?
yes, go right ahead.
I have white tongue. My tongue is white. And I want to know what's causing that, and I want to know if I could get a remedy for the white tongue. My tongue is white and burning me.
Okay. All right. Well, the thing is, your tongue, I tell people, if you look at your tongue is a reflection of your intestines. So if it is your tongue is coated very white, is an indication of buildup. So I don't know how your oral hygiene goes in terms of, brushing your teeth. And keep in mind, I'm giving advice here, I'm not trying to be condescending or anything like that, right? So a lot of the times, sometimes you have to check the toothbrushes that you use. Now, you're not supposed to use hard toothbrushes. You're supposed to use either medium or soft toothbrushes to brush your teeth, right? And of course, you need to brush your tongue. If you're still doing that and you have an issue, the possibility exists that you're in need of a cleanse, because as I said, your tongue is basically a manifestation of what your intestines would look like, right? So a cleanse I would recommend, the Santulan could work there, your 7-channel detox. And as I said, look at your oral hygiene. What you may need to do, change your toothpaste. Try and not use toothpaste with any fluoride in it. Even though some people debate a lot about that, but I tell persons it's better you use the more natural toothpaste. You could actually use some baking soda as well to brush your tongue, and start to do that and see how that goes with you. And you should get some good results there.
All right. Hello, good morning. Welcome.
Good morning, Doctor. Dr. Batson, I have arthritis in the knee.
Uh-huh.
I'm supposed to get a knee replacement. The longest while. Every morning I'm pain, real pain.
Which knee giving you the problems?
And in the both knees.
Both knees? All right, so let me ask you your business a little bit here. What kind of weight you're carrying? Would you consider yourself to be a heavy person? Or your weight correct?
No, doctor, normal weight.
Normal weight?
Weight, yeah.
Okay, well, what you need to do is start to drink some sea moss. See if you could get some sea moss. You could blend it in a moisturizer. You could use like banana, pumpkin, that kind of thing. No milk, no sugar in it. Right? And then there's a product that we carry called inflammation formula. You see what you need to do? You need to build back the cartilage and get back the synovial fluid. But the only way to do that...
It's gone.
No, it's gone, but it could come back. There are things to build and repair that,
Okay.
Yeah, there's a product that we carry. I'm getting some problems to get it. Simply because, but we should have it by month 10. It's something known as collagen and hyaluronic acid. But again, I'm very brand specific at the ones that I use. I don't like powdered collagen so much. It depends on which one I get, but the liquid ones I prefer. And we should get that, God's willing, at the end of the month. But in the meantime, what you should do, try and get some sea moss, good sea moss, and start to blend your sea moss. If you could use it every day, you're going to start to see some improvement. At Batson & Associates, we carry a joint tea, and we also carry something called inflammation formula. Because a lot of the times...
St. James?
Yes, we have in St. James has.
I live for the space.
Okay, well, yeah, you'd be able to get it in St. James. And once you start to do that, how much water are you drinking? Do you drink the correct amount of water? Or?
I just drink a lot of water, yeah.
Okay, good. And, well, no such as sugar, right? So you're not drinking soft drink and too much of coffee and all those type of things, right?
What kind of St. James you are?
We are in Red Edge Mall. Yeah, that's on the Western Main Road. The opposite, where they have that vegetable mart there. Opposite that.
Right. Okay, that's the free price of it, doctor.
Once you call the office, they'll give you the information regarding the price, my dear.
Okay, doctor. Thank you.
All right, the number, if you want the number for St. James is 220 8113.
Okay. All right.
So 220 8113.
Okay,
All right, don't let nobody fool you with that knee replacement. You're going to put that there, that only lasts in 10 years. And then you're in more pain than before.
I'm telling you.
Yeah.
All right, thank you so much.
Have a blessed day.
You too, my dear.
Likewise.
Take care of yourself.
Hello, good morning, welcome.
Morning, Mr. Green.
Hi, good morning, man.
I'm here to testify fact that Dr. Batson medicine really works.
Go right ahead, man.
You asked him, if you remember, a guy came about 3 years ago and told him, I smell a rat.
Uh-huh.
Yeah. If you remember a guy.
Yeah, I remember that.
Nice. So I'm here to testify that your medicine really does work.
Okay.
For those who are listening, sir, if it's possible, for those who are listening, could you share what was the challenge and what exactly did you use, please?
Well, I use a lot of stuff like this to learn the information, formula, the chlorophyll, and all the like, you know, sir?
Mm-hmm.
And I got great results. And up to this day, I'm still having good results from interacting with female office.
Okay. Miss Roma?
Yeah.
Okay.
I'm a regular customer of yours.
Yeah, I recognize your voice, man.
Right, bye-bye.
All right,
so
boss.
much.
Thank you for that.
I was trying to get him to share with us what was the issue, so that those who are listening,
Right.
who may have the same issue that they can share as well. The number is 624-7729, 624-7729, 625-2759. We have a...
Let me say a pleasant good morning to Miss Cindy Hoyt. Miss Hoyt says, good morning, Dr. Batson and team. I'm late for school today. She apparently now join us. Don't worry. As they say, better late than never.
Yes, welcome. Thank you so much for joining us.
You want me to answer the question that you asked me, Dion?
Oh, yeah, please. And pronounce that word. Let me hear it.
The word is pronounced. It is spelled Costocondritis. It is pronounced.
I didn't want to curse now. Next thing you know, I try to pronounce something other way.
It is pronounced costochondritis. Costochondritis is the pronunciation. And it is actually inflammation of the cartilage that connects the rib to the breastbone, which is your sternum. So that's here. Right? And pain caused by that could actually mimic that of a heart attack and that type of thing. People who have that situation is usually persons who would have had some sort of injury. So the possibility exists you either lift up something, you fell. Pregnant women get it too, because sometimes depending on how long you would have been pregnant for, and depending on the size of, the belly, you could have gotten strain in that area. As regards to remedies to correct it, the inflammation formula would help. I would always recommend a chiropractor in that situation to actually put back certain things in place, and then you just build the musculoskeletal system. The thing is, you have to keep in mind that your musculoskeletal system is the system that is muscles, bones, tendons, ligaments, all those type of things. So what you have to keep in mind is that those systems could rebuild themselves. You hear people like the lovely lady who was talking about her knee replacement situation. Let me tell you something. Once you could avoid surgery, avoid it. I always tell people that. Surgery should only be emergency. What a lot of persons have to understand as you start to get older, especially women. Remember, women would have given birth to children. And depending on how many children that you had, you would have lost a lot of minerals, which is why when women going through menopause and PMS, a lot of them have weakness. The reason why you have weakness is because the bones themselves become very weak. The whole musculoskeletal system is weak. And that's why I always tell persons, you get wonderful free advice. If you could drink all the sea moss in the world, it will help you. Now, in situations where you need more than that, that is where things like your inflammation formula would come in, your collagen and hyaluronic acid. The thing with collagen and hyaluronic acid compared to other supplements, it tends to be a little more pricey because collagen is an expensive thing. Hyaluronic acid is also very expensive. They always tell people collagen is something some years ago. You only used to hear people in Hollywood talking about that, because it's daily people could afford it. All these stars and actors, that's what they used to give them to keep the skin, because collagen is an active ingredient in your skin, hair, nails, and that type of thing, So if you want to look younger and improve and have a youthful appearance, collagen is something that you would have to consume. But as I said, it is not one of the cheapest things because of what it has the ability to do. But it is a masterpiece for your knees and your hips and that type of thing. So don't go and do hip replacement and knee replacement just so. If it is you're having a knee problem and you might be a bit overweight Because, well, that lady who called her, she said her weight is good. But there are some people, usually you tend to be heavier than you're supposed to. And if you're heavy, you're going to get problems with your knee. Because remember, your knee wasn't really made to carry all that weight. So there are some ladies that I've seen women who, you know, you might be on the thick side. You have plenty hips and buttocks and that kind of thing. But, you know, it's a little overdone in the sense that the weight could be less. So someone in a situation like that, I mean, you don't want to look skinny and hungry like you don't eat, but at the same time, it might require you needing to lose some weight. It's the same situation with things like polycystic ovarian syndrome and fibroids and those type of things. A lot of times when women start to lose weight and they start to exercise, you find POS would even go away just with exercise alone, apart from things like the cyst and fibroid formula and women's formula and that type of thing. So, you know, it's a matter of being proactive and really try to do what you need to do as regards to that. Because you don't want to take what I think. You do not want knee replacement. Knee replacement only lasts 10 years. I mean, I don't know how old you are. If you're 80 years or 70 years, you're telling God you only want to live till 80. So from 81, what will happen to you? You're going to be in problems, right? So we try to go as natural as possible. We try to put back things into the body. And as I was telling someone recently, Dion, people don't understand how they need to supplement. I use nothing less than 5,000 milligrams of omegas for the day. In some cases, I would use 10,000. But I know why I do that, because of my requirements, especially mentally. I have a lot of work to do. And if I wasn't doing that, Ole would have a mad doctor. I mean, Ole already know I ain't to write in the head already. But I would have been worse off. You understand? Because you have to understand requirements. Look, even vitamin C. Quickly, I was looking at this gentleman, Linus Pauling. I mean, he was one of the most intelligent people who lived in our time. He won 2 Nobel Prizes. One was for chemistry, the next one was a Nobel Peace Prize. But when you understand automolecular medicine and what the man advocated, a lot of people disagreed with him, where he was saying you should use up to 10,000 milligrams of vitamin C for the day. But they saw a lot of wisdom in what he was saying, because the institute that he formed, there was a lot of people that he was able to help. When you look at people like Dr. Pendergrass, who was one of the foremost authority on nitric oxide, he was actually able to help a lot of persons with diabetes. He helped reverse a lot of diabetes. He helped to help a lot of diabetics keep their limbs, because he had people who came to him with serious diabetic ulcers and they were going to lose their foot. When you look at people like Professor Egnaro, who's the doctor who won the Nobel Prize in 1998 for nitric oxide and what nitric oxide does to the body. These are men who pioneered and proved that when you look at supplementation, how important supplementation is. And that is something you cannot get away from. Look, even D3. I was doing some research recently where they were talking about people who have like serious musculoskeletal problems and joint pain and that kind of thing. You can't use no 5,000 IUs at D3. You need to use about 20,000 IUs. So a lot of people sometimes are fearful for using supplements. But let me tell you something. It is very difficult for you to overdose on a supplement. Very, very difficult. Your body is intelligent enough. Remember, this is something that your body naturally has enough. So if you take too much, what the body is going to do? Not get rid of the excess? It's not drugs, it's not aspirin, it's not Panadol, it's not those type of things you're taking. It is something that your body requires. The same applies to zinc. Look, it's only because of COVID people know about zinc, but I use zinc must be 15 years now I use zinc. And zinc is something we have seen with zinc deficiency in men. Most men who end up with prostate cancer is zinc and selenium deficiency. We realize now a lot of people who have cancer, if you check the background, selenium deficiency. So a lot of the times you feel you're eating and you might be eating pretty well. So you might be, more vegetables, more fruits. But I am telling you, Trinidad and Tobago, you need to supplement. You need, especially if your job is a high demanding, stressful job. If you do not supplement, you're going to end up on the wayside. Take what I'm telling you.
And let me just clarify. When you say supplement, what are the supplements that you are actually looking at? Just for those who are listening.
I mean, general, you always stand a good chance with a D3. I recommend at least minimum 10,000 international IUs. If you have a serious musculoskeletal problem, 20,000 IUs. Most of the time, D3 would come in 5,000 IUs. So you normally take like about 4. The one I use is 5,000 IUs. Actually trying to bring that in because I buy that for me personally and my family. Zinc, they tell you with zinc, I know some people have some challenges. They were saying that when you're using zinc, you shouldn't. I can't remember the amount that they were saying. But with zinc, you could up that, especially when you're looking at immunity. So zinc, D3, your vitamin C. I'm a big advocate of vitamin C. I tell people, if you want to see improvement in your body, start using your vitamin C, ascorbic acid. Minimum 2,000 milligrams. If things are real bad with you, you're under stress, you have diabetes, you have an ulcer or some kind of thing like that, you need to go up. You're going up to about 5,000 milligrams. Me, yesterday I found I was feeling a little kind of funny. I feel like I again, I was scratching my throat. I said, listen to me. If this had to be anything remotely looking like anybody, I'm not playing with that. Yesterday I took 10,000 milligrams of vitamin C. And this morning when I got up, I was fine. I'm not playing that.
That's why I said, Dr. Batson, come out, you looking...
Yeah, well, so is the vitamin C. What must be? I'm looking a little radiant this morning. Yeah, and then you have things like your nutrient-dense greens, because when we're looking at supplementation, there are a lot of other things. We use like phytonutrients. We use things like alfalfa, different things. So it depends on the need of the person. Then mushrooms. I'm a big advocate of mushrooms. Now, there are some people, for religious reasons, they don't like to use mushrooms. Okay, good. I not, I can't dispute or argue with you where your religious beliefs are concerned. But I'm a big advocate of mushrooms because they help significantly with immunity. Mushrooms are one class of organisms that are known which is by Chinese people. If you look at the Asians, they use a lot of mushrooms, right? Yeah. And again, that's blue zone. When you look at people in Japan, Philippines, certain parts of China, blue zones, these are people who live to 100 and in some cases over 100. You have people 150. Now when you see Tanti and Uncle, they look like, I feel they could give me a run for my money. So it comes down again to what you put in.
Okay, so Dr. Batson, someone is saying, because we're running out of time.
Of time, yes.
But, someone asked, they mentioned that their daughter is having some sleeping problems. Okay. Major insomnia. And they're having problems sleeping. Could you suggest what they can what can they use, please? And I'm seeing a lot of messages, and I'm seeing your calls. I try to, for those who are listening, I try to take your calls in order and your messages in order. Yeah. So if I don't respond to your messages, please forgive us. Right? It's just we're trying to follow an order there.
A proper sequence. Yeah.
Yeah. So that it's fair.
Yes,
okay?
Definitely.
Or possibly if I go into the messages and I see one that is related to maybe kidney or something like that, I may try to address that one first. All right. I want to address the sleeping disorder for the child because
how old did they say how old the child is?
No, I was trying to look again for the message, but I did not see the message. I'll try and see if I can find the message. But the child, it's a child.
Okay, cool. But the thing is, if the child, again, first thing I'll look at hydration. So look at the water. Make sure they're consuming the correct amount of water for the body weight. If you want, and funds allow, and you can get the alkagen water, do that because that water does make a difference, especially if you're addressing an imbalance that they may have, which is the reason why they're not sleeping. The nerve restore in terms of age, boy. Where's the age limit on nerve restore, boy? The thing is, nerve restore, children 5 years and up could use nerve restore. The only thing, you may have to open the capsule and give them half and dilute it. But definitely the nerve restore will help. But as I said, look at what is going on with the hydration. Most of these children not drinking enough water. And you need to watch the diet. You need to watch out the snacks. You need to watch out things like soft drinks and those type of things. Try and limit the consumption of those things. More fruits, more vegetables, that type of thing.
Dr. Batson, let me just ask this. This morning, Dr. Batson, I have a friend who's up for eye surgery tomorrow. The problem started when some particle got into his eye while doing some wacko work around the yard. That particle is still there, and now he's going to have his lens replaced. He does not know if the surgery will help because the surgery is not to remove the particle.
But that's interesting. Why wouldn't they remove the particle? Why are you changing the lens for? They sure they have all the information for that. That sounds a bit
sounds
that sounds strange because if you have a particle in the eye, because in a case like that, once there's something in there, then it needs to be surgically removed.
But if it hits the lens,
Well, the thing is, if it hits the lens and it's in the lens, but it's very difficult for something to be lodged in your lens for an extended period of time. I mean, just based on, there's more to that story. We need to get the full,
Okay.
But if there is something lodged in the eyes, well, then surgery, I have no choice in the matter. They have to surgically remove it because that's the only way they will get it out.
Someone here says, blessed morning, my pressure reading was 150/90. I have a half bottle of silver. Can I drink the silver? And if so, how regular?
Yeah, you can use the silver. Silver, we normally recommend you use like 2 ounces to 8 ounces of water. So that'll be 10 ounces in all, and you drink it. You can do it once a day. As regards to the blood pressure, you need to bring that down a little bit. That 150/90 a little too high. In both instances, the systolic and the diastolic. So I would recommend some olive oil. I always tell people olive oil is a very good thing for blood pressure. Very, very good. Take a little teaspoon of olive oil every day. Apart from that, what we carry at Batson Associates, we have our hypertension tea. That's a big seller. There's actually an olive tea that we carry that is olive. It's not like the local olive because this is like olive from the Mediterranean. And a lot of clients get very good results with that. So you need to pay attention to that. Look at your water intake as well too and see how your hydration working, and then you should see some benefits where that is concerned.
All right, let me just take this call. Hello, good morning, welcome.
Morning, Brother Green.
Good morning, sir.
Long as well as trying to reach Dr. Batson.
Yes, sir.
I wanted a recalibration of myself.
Could you repeat that, please?
Recalibration. I want to do a calibration of myself at General.
At General, okay. Which area are you calling from?
San Fernando.
So which office you prefer, Davey or Shogunas?
No, well, you tell me. You advise me here.
It would be easier to see me in Shogunas.
Okay. So what I have to do?
Okay, so call 222-8261.
Yes, now.
Yeah.
Tell me.
No, 222, so 222.
Yeah.
8261.
8261. Okay.
Right, and tell them you want an appointment with myself, and they will I'll try my best to fit in as soon as possible.
Okay. Tell me one thing.
Yes, sir.
I'll be trying this number sometime and I begin difficulty to reach it. Are there any options?
Well, you have the 314-9975, that too?
314-9975.
Take this number too, because 314-9975.
Yeah.
And let me give you an easier number. 223
223
7515.
7515.
That's Debbie. So if you call Debbie, Ms. Roma will take the information and it will be easier for her to pass it on to Shogunas. Because sometimes, because that's head office, those numbers tend to be very
All right, I'm ready.
Okay, sir, no problem.
All right, thank you. Take this question. Hello, good morning, welcome.
Yeah, good morning. I again with the oolong. I want to know if I have to be on a diet to take it to lose the weight.
Well, yeah, if it is so you're looking at losing weight?
Yeah.
How much weight are you trying to lose?
About 80 pounds.
About 80 pounds, okay.
Yeah.
All right. But what are you going to have to do with that? Do you think with oolong tea, you don't drink oolong tea in the night, eh? You know that, right? If you're drinking oolong tea, the latest you should drink oolong tea is 2 o'clock in the day. Because if you drink it later than that, you would not sleep. That is a tea that gives you energy, right? And what we have a product coming out. I am hoping it all goes well. It should come out by the end of the month. Something called Santulan Slim, which is going to be similar to the Santulan, but it's going to be focusing more on weight loss. That's something you could look at. As regards to your diet, what you can do intermittent fasting. That always helps. And intermittent fasting at 12 hours usually works. So if you have your meal, your last meal, your first meal, sorry, so some sort of protein. So you could do like boiled eggs, you do like chana, something like that, a piece of fish for breakfast, and then throughout the day you drink water and hot teas, right? You may have to get an additional tea other than the oolong, because remember you cannot drink that oolong tea after 2, right? And then what you do with the intermittent fasting, you break fast 6 o'clock, And same thing, you do protein. So you could do, again, eggs or vegetables, something like that. Right? And you could do the intermittent fasting like twice for the week. What you want, you do not want simple carbohydrates in your diet. So less rice, less potato, white potato out, completely out. Bread, take that out. The thing is, once you take out bread, rice, and potato from your diet, pasta, you tend to lose weight easier because those things tend to have you bloated and contributes to weight gain and that type of thing. More hot teas, no cold water at all. Drink your water room temperature, and you should see some results there.
Okay, and you said take out bread.
Yeah.
What I could use instead of the bread?
You could use we could use instead of bread, use some.
So if you mix, if you put whole wheat and all these things, bran and all of that.
That under normal circumstances would be good. Remember, you say you want to lose 80 pounds. So I go in based on what you tell me. So what I would suggest you do is get the quinoa and start to use that. You know what quinoa is, right?
Yeah.
Right. So start to use the quinoa. A lot of people think that they can't make out without bread, and I don't understand that. You just need, okay, so let me give an example. Your breakfast could be a piece of sweet potato, a piece of dasheen, and some grilled fish or something like that. That could be a breakfast. We need to come out of this mentality that we have to have bread, breakfast and dinner. You understand what I'm saying?
Yeah.
Yeah. And once you do that, you will lose the weight. Because remember, it's 80 pounds you say you're trying to lose, that's a lot of weight.
Oh, and I know a woman who told me say she using all eating regular and she losing weight with it.
Well, go Pollock is not see Pollock. You don't know what she's doing. You don't know her metabolism. Remember, everybody different, And you don't know what she may be eating. She may be eating a lot, but it's what she may be eating. A lot of vegetables, a lot of fruits. You don't know. You understand what I'm saying?
Yes.
All right,
Thank you. Thank you very much.
You're welcome.
Hello, good morning. Welcome.
So good morning.
Good morning.
I have some information concerning the celiac disease. Can't eat anything with it.
Can you repeat that, please? You're trying to get some information on
celiac disease.
Right.
Anything with it.
Okay.
Or celiac disease. The thing is, people who are diagnosed with celiac disease and this issue with gluten, those people have a lot of problems with the liver and the intestines. So sometimes it's not a matter. The problem is that the liver identifies everything as toxic and therefore now gives a reaction, which is an allergic or some sort of anaphylaxis or something like that. So usually someone, in the instances that I have dealt with people with celiac disease, we always did work on the liver and the intestines and they got better. So a lot of the times the individual may have problems. I don't know what the water intake looks like. They're usually very dehydrated people too. So yeah, a lot of people with celiac disease are people who don't like water. And that is something that contributes to, because you have 7 channels of elimination: kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. But your liver is the organ that is give you allergies. Anytime people say they have allergies, it's really the liver that needs addressing.
Okay.
All right?
What do you recommend for that?
Well, what she needs to do is up the water first. So that's the first thing you need to do. So if it is alkaline water is a possibility for you, let us start to use that using the same formula, body weight divided by 2 in ounces. Remove anything from the diet that doesn't make sense. If we're looking at processed foods, if we're looking at things like soda, snacks, all those type of things, take that out of the diet. And then from there now, you will start to see some improvement, and then we would have to work additionally, whether we look at our liver, some sort of liver cleanse that we carry, Santula and something like that. We have to do things in... Beg your pardon? Repeat that?
Knee problem.
She has what? Knee problems?
Yeah.
What is the problem with the knee?
She get pain.
Okay, so that's indication of inflammation in the musculoskeletal system. But how much water do you think she normally drinks, based on your observation? And what about the diets, in terms of things like soft drink and coffee and all those type of things?
No, she don't drink that. Because of gluten, she doing anything with gluten and only water. She is very healthy.
All right. All right. Well, it has some inflammation there, but we could deal with that situation. But definitely liver, gastrointestinal needs addressing there.
Okay. So what's the penal branch? So I live in penal. I'm going to get in contact with the branch of
Penal
penal.
number is 223-75. Yeah, 223-7515.
223-7515.
Correct.
Okay. No problem.
All right, thank
So
you.
this is the penal branch.
Okay, sir.
Thank you very much, sir. Because of time, we have to close now. I just want to ask this final question, Dr. Batson. If someone has, they were suffering from COVID, the COVID is over, but they still have a cough. What is something that they can use? Because I've been hearing about that a lot.
Yes, what they need to do, and this is not me trying to sell business, but people are very hard and they don't listen. If you have gotten COVID and you have problems breathing, you need to pay attention to that, because as I was telling them, if you look at the news within recent time, you realize there are a lot of persons who got COVID, got over, and subsequent to that, they died. They got things like tuberculosis, they got things like bronchitis, because your lungs have been compromised. So you have to correct the lungs. So there are a number of things that you need to do, things like your lungs, even simple things as it relates to a lot of hot beverages, no cold beverages, that type of thing. There's a product that we carry called Tropical Lungs. That product actually helped a lot of persons in that situation, apart from the lungs tea. If it's really, really bad, then I'm going to have to give you an enzyme formula that we carry, but that is not something to play with. You can end up in a serious situation, and it makes it easier for you to get COVID again. And when you get COVID the second or the third time, well, you might be in some serious problems. Okay? Try and get your zinc and your D3. Try and up those numbers with regard to that, your vitamin C. And, well, then we could always give you something specifically for the lungs.
Definitely. Guys, we want to thank you so much. We do apologize because of time. I do see a lot of your messages, but because of time, we are unable to take those messages. Yeah. Dr. Batson can be found on Facebook.
Yes.
All right.
Yeah, on Facebook, we are Batson and Associates Limited. Let me quickly say a pleasant good morning to Miss Barbara Alain, Miss Alicia James, Miss Pamela Moses. So you all can get us on Facebook. We are Batson and Associates Limited. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. So like and share so that other persons can be blessed by the information. Dion says, always a pleasure to be in your company.
Yes, sir.
Yes, sir. For some reason, this Sunday was extra special. I need to take more vitamin C and drink Santulan.
Yeah, you're back on the fundraising. You have to take that break.
Yeah, I need to take a break often.
Vitamin C, man.
Yeah,
Thanks so much, Dr. Batson, for your knowledge and your wisdom and blessings on your business.
Thank you very much.
Right, man?
Yes, sir.
God bless you.
You too.
Thank you so much.
Yeah.
And you're listening to Sky 99.5 FM. You've just been listening to Dr. Batson of Batson and Associates here with us on a Sunday morning from around 9.
Yes, Facebook family. So a pleasant good morning to Miss Alain, Miss Pamela Moses. Thank you for your support. You're real. Got a lot of people on this morning. So, till next week, please God, we on Thursday, God's willing. And remember, we have that program on Thursday from 11 to 11:30. That's 103.1 FM. And then we'll be on Freedom 106.5 FM. And that's from 1:15 to 1:45. That's 30 minutes. Okay? So, the questions that I didn't answer, I try my best to get to them. Right? And yes.
We have a night program for them. So the questions we didn't answer, we'll be able to answer in the night program.
On the night program. Well, you all will get, not tonight though.
Yes,
but we have a night program for you all sometime. All right? So Facebook family, always a pleasure to be in your company. I hope that you were blessed so that you can bless someone. Remember, take care of yourself, take care of your family. Until Thursday, God's willing, you all enjoy the rest of your day. Okay? Remember, as we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive, try ignorance. God bless you guys and enjoy the rest of your Sunday.